All right. Well, thank you for having me back one more time. It's great. I'm presenting actually on behalf of Dr. Guadalupe Palos, who did an evaluation of the communication education program, Tele-mentoring program that we use as part of our project. So let me share this with you. And this is the component I mentioned yesterday when I was talking. It seems like a long time ago, but yesterday when I was talking to you, that we use this tele-mentoring program. It's called ECHO, and this is a program. The name is Extension for Community Health Outcomes. This was developed by Dr. Sanjay Arora at the University of New Mexico to educate and work with primary care physicians on managing treatment for chronic hepatitis. So he was able to demonstrate that this could be done successfully, and he actually compared outcomes in the primary care clinics with tele-mentoring to those in the tertiary care center, and the outcomes in primary care were better. So this has since been disseminated. It's used in many different parts of the U.S. and internationally. So it's a very useful tool in educating and helping people change practice. So basically, this was just a survey that looked at the participants in our program about their impressions of that part of the program. But this is the ECHO. I'd encourage you to look at their website, this Project ECHO, and they've got a nice little set of videos and instructions about the program. But it really is different from traditional telemedicine, where it's one central cancer center or academic center clinician working with one patient remotely, perhaps with the assistance of the primary care team. But this is, we gather a group of subject matter experts on our end so we can discuss patients that are presented by the primary care team. So all three of our groups connect together. We have groups of residents at each of our sites. We all link up once a month and have a conversation basically on patient care. So it's group learning. Everybody teaches, everybody learns, and this magnifies the impact of the subject matter experts in the center across a large number of patients. So the results that we got were that we had a little less than 50% response rate, so we proved once again that trainees do not read their email. We tried. So, but of those who responded, they did give us fairly good scores. It's another truism that it's really difficult to keep trainees happy, whatever you're doing with them. But it's us. We didn't do a good job. But no, they had a lot of suggestions about how we could do things better, and they were valid. So we've made some changes in how we've approached the sessions. So that was actually quite helpful. But in the meantime, they rated it fairly highly as being able to be a tool which helped them do a better job and learn more about taking care of patients, and that felt that this was a helpful part of our interaction with them. So that was a little bit reassuring. So overall, the groups, the trainees that were participating found these sessions useful, and feel like they're helping them to integrate care for their patients, and we're using those suggestions that they gave us to make the project a little better. So again, just our collaborators at the Cancer Center, and then all of our great folks in the community programs that we work with. So thank you very much.